Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com and week 40 of your pregnancy. I'm Monica Healy. Wow, you've made it to 40 weeks. Hasn't the time just flown by? Are you as excited as I am? Okay, let's see what is happening with baby this week. Still growing. Your baby tips the scales at an average of 7 to 8 pounds, 3.2 to 3.6 kilograms, but has slowed down in length somewhat, still around 21.5 inches or 54 centimeters from head to toe. It is common for babies to be smaller or larger than this estimate, but rest assured that your little one will still be within the realm of normal. For the remainder of her stay in the womb, baby will continue to shed the vernix and lanugo that was originally covering her skin, and you may still see traces of them at birth. Fat will continue to accumulate, but baby's chubby enough to regulate her temperature with the aid of any adorable newborn outfits you may have purchased. Baby's hair and fingernails are still growing, and while many babies are born with a full head of hair, it is completely normal for some to be bald. Most of the newborn hair is lost within the first 3 weeks of life and replaced simultaneously with proper hair. Internal organs are ready and availing her first breath of oxygen. The lungs are fully mature, and as baby produces large quantities of cortisol, the lungs pump out plenty of surfactant to create a smooth transition from amniotic fluid to air. Her heart is beating anywhere from 120 to 160 beats per minute. When she inhales her first oxygenated breath, dramatic changes will occur within the heart and circulatory system. The digestive system is another major player at birth. It is ready for its first taste of liquid food. In fact, the system has already been hard at work as baby has ingested dead skin cells and remnants of lanugo, which have combined with secretions from the bowel, liver, and gallbladder to create a green, sticky substance called meconium. Meconium will be passed within the first days of life, but if your baby becomes distressed or frightened during delivery, she may have a bowel movement into the amniotic fluid. If meconium is visible in the amniotic fluid after the waters have broken, it may signify that she is experiencing stress and may need to be closely monitored or given antibiotics afterward. Once your body has initiated labor, it will spur on some changes within baby. Baby will experience a surge in hormones, which may help maintain blood pressure and blood sugar levels after birth. It might also have something to do with communicating to your uterus that the time has come. The increased hormones can cause swelling in the genitals, breasts, and even his or her nipples may even leak a white substance. Circulation will also change as each contraction decreases blood flow to the placenta. Baby is ready to tolerate short periods of decreased circulation as your uterus prepares to push baby through the birth canal. Her skull is just as tolerant as his circulatory system, able to be molded as she is squeezed through a tight tunnel. Baby's head may appear misshaped after birth or cone head, but it'll correct itself within a few days. Baby may also appear blue, purplish, or pale yellow and covered in a variety of substances, including vernix, maternal blood, lanugo, and possibly bits of meconium. He may experience skin discoloration, spots, or dry patches, which will usually fade over time. Okay, let's see what's happening with you this week. Happy due date. Your due date is here. Don't expect to have baby on the actual day, since only 5% of babies will arrive on their predicted delivery date. The due date is simply an estimate based on your last menstrual cycle, and many women ovulate early or late within their cycles. Needless to say, baby will come when she's good and ready. If you remain pregnant for the next day or so, your practitioner may suggest a biophysical profile in order to ensure that baby is safe and sound within your womb. The biophysical profile will include an ultrasound to observe baby's overall movements, such as the ability to flex fingers, hands, and limbs, and even practice breathing. The ultrasound will be used to monitor even more breathing movements as well as muscle tone. The practitioner will also look at the level of amniotic fluid. If for some reason he or she feels that it is not an acceptable level, it will be induced as soon as possible. If everything checks out, then you will not be induced unless you have not naturally reached labor sometime between the 41st and 42nd week. Final demands. With the due date coming and going, you are probably feeling more impatient than ever to meet your baby. The growing discomfort of your ever-expanding abdomen may also be getting to you. Believe it or not, your lungs are struggling to absorb 20% more oxygen than usual, leaving you a bit out of breath. The final phase of pregnancy is very demanding on you. Many women feel uncomfortable throughout the last months. The weight of the baby, pressure on your spine, and the battle for space in your midsection can make your back and legs ache. Hold strong. You are so close to the end now. Perhaps the increasing discomfort is your body's way of strengthening your desire for delivery and quelling the fear of delivery that you may have experienced in the second trimester. Decisions. If you are a procrastinator, the time has come to make all the final preparations. Be sure that the car seat is installed, the bassinet made up, hospital bag packed and by the door. It's also a good time to fill the car with gas and charge up your cell phone. There will be plenty of joyous calls to make when your little one enters the world. You will also want to review any breathing techniques that you may have learned. False labor contractions, being stronger than merely Braxton Hicks, are a great time to practice your relaxation and breathing strategies. Review your birth plan with your partner, because once you are in full labor, it will be up to that person to enforce the birth plan. Nevertheless, be flexible, because some labors do not go according to plan. As you've probably imagined, labor is very painful. Thus, decide whether or not you will use pain relief. Keep in mind that even if you have decided to go all natural, you can change your mind at any time. Here are some of my tips for week 40. Some women choose to invest in a waterproof mattress cover in the event that their water ruptures while in bed. It's not a bad idea when you consider that many other wet substances may hit the bed once the baby's home. So that's it for week 40. Hasn't this time just flown by? If you have any questions or comments, please join in the conversation in the forums at pregnancychat.com. I'm Monica Healy, and thank you so much for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.